Have you ever wondered what to do when someone gets a cut, burn, or fracture? Welcome to our deep dive into the world of first aid. It's a subject that touches all of us, whether we're hikers scaling mountains, parents managing a bustling household, or just everyday people living our lives. The unexpected can happen at any moment, and having a handle on first aid basics can make a world of difference. In this comprehensive guide, we're going to focus on 3 common injuries that can occur anywhere, anytime: cuts, burns, and fractures. We'll go through the steps on how to handle each one, giving you the confidence to act when it matters most. Remember, a little knowledge goes a long way and can potentially save a life. So are you ready to arm yourself with some life-saving knowledge? Good. So stay tuned as we delve into the basics of handling cuts, burns, and fractures. Scene script. Imagine you or someone around you gets a cut. What would you do? Cuts are common injuries, especially among those who love outdoor activities. But no matter the size or severity, it's essential to know how to treat them. Let's dive into the step-by-step procedure for handling cuts. The first step is to clean the wound. You might be tempted to run for the Band-Aids, but hold on. Before anything else, you need to wash the wound with clean, warm water and mild soap. Avoid using harsh soaps, hydrogen peroxide, or alcohol, as these can actually delay the healing process. Next, it's time to stop the bleeding. Apply gentle pressure to the cut using a clean cloth or bandage. Keep the pressure on until the bleeding stops. For minor cuts, this should take a few minutes. If the bleeding doesn't stop or the wound is deep, seek medical help immediately. Once the bleeding has stopped, use an antiseptic to kill any lingering bacteria. This is a crucial step in preventing infection. Apply a thin layer of antiseptic cream or ointment to the wound. Now, you're ready to dress the wound. Use a sterile bandage or dressing large enough to fully cover the wound. Secure it with adhesive strips or medical tape. Remember, the dressing is there to protect the wound from bacteria and dirt while it heals, so change it daily or whenever it gets wet or dirty. In the days following, keep an eye on the wound. Watch out for signs of infection, like increased pain, redness, swelling, or pus. If you notice any of these, seek medical help right away. And here's the most important part. If the wound is deep, won't stop bleeding, or was caused by a rusty or dirty object, it's crucial to seek medical attention immediately. Trying to treat serious wounds at home can lead to severe complications, including infection and permanent damage. Remember, serious cuts or heavy bleeding require immediate medical attention. In the end, knowing how to properly treat a cut can save you or someone else from unnecessary pain and complications. So stay safe and keep this knowledge in your first aid toolkit. Now, what if someone gets a burn? A burn can be a serious injury, and knowing how to respond can make a significant difference in recovery. When someone experiences a burn, their skin cells are damaged by heat, electricity, chemicals, or radiation. The first step in handling a burn is to remove the person from the source of the burn, if it is safe to do so. Next, it's crucial to cool the burn. This can be done by running cool, not cold water over the burn for about 10 to 20 minutes. Please note, never use ice or icy water on a burn as it can further damage the skin. Once the burn is cooled, it's time to cover it. Use a sterile, non-stick dressing if possible. Cling film can also be used in a pinch, but make sure it's not wrapped too tightly. The goal is to protect the burn from infection while it heals. Sometimes burns can cause blisters to form. While it might be tempting to pop these blisters, it's essential to leave them alone. Bursting a blister can expose the burn to infection, and it can also prolong the healing process. One thing to remember is that burns can be more severe than they initially appear. If the burn is larger than the size of the person's hand, if it's on the face, hands, feet, major joints, or it's a deep burn, it needs immediate medical attention. Also, keep an eye out for signs of shock. These can include pale and clammy skin, rapid pulse, or fainting. If the person shows any of these symptoms, make sure they are lying down and elevate their legs if possible, while you seek emergency medical help. Remember, first aid is exactly that, the first aid. It's not meant to replace professional medical help. It's there to help manage the situation until professional help arrives. Keep in mind, severe burns should be attended to by a healthcare professional immediately. And what if someone gets a fracture, you may ask? Well, dealing with fractures can be a bit intimidating, but with a few key steps, you can help to alleviate pain and prevent further harm. First things first, it's crucial to keep the injured person as still as possible. This is to avoid causing more harm to the broken bone and surrounding tissue. It's a bit like handling a delicate piece of pottery. You wouldn't want to cause more cracks, would you? Of course not. The same principle applies here. Next, immobilize the injured area. If you have splints, great. Use them to immobilize the injury. But if you don't worry. You can use any rigid item, like a board or even a rolled-up newspaper, and some bandages or clothing to secure it. The goal here is to prevent movement and provide support to the area. Now, you might be wondering, what about providing support? Excellent question. You can use a sling for an arm injury or crutches for a leg injury. This is to keep the weight off the injured area and to keep it elevated. Remember, we're trying to minimize movement and reduce swelling. Finally, and this is perhaps the most important part, seek immediate medical help. Call an ambulance, go to an emergency room, do whatever you can to get professional medical attention as soon as possible. Time is of the essence in these situations, and the sooner a medical professional can assess and treat the fracture, the better the outcome will be. Now, here's a very important point to remember, and I cannot stress this enough. Do not, under any circumstances, try to realign a broken bone yourself. You might think you're helping, but without the proper training and equipment, you could cause more harm than good. Leave that to the medical professionals. They're trained to handle these situations. So there you have it. Keeping the injured person still, immobilizing the area, providing support, and seeking immediate medical help. These are your steps to managing fractures. Always remember, do not try to realign a broken bone yourself. Leave that to the medical professionals. Let's recap what we've covered today. We've journeyed through the essentials of basic first aid, looking at dealing with cuts, handling burns, and managing fractures. Starting with cuts, we learned that the first step is to wash the wound gently with mild soap and warm water to prevent infection. Applying pressure with a clean cloth helps stop the bleeding, and once it's under control, a sterile bandage or adhesive strip should be used to cover the wound. Remember, if the cut is deep, won't stop bleeding, or was caused by a rusty or dirty object, it's time to seek professional medical help. Next, we moved on to burns. We discovered that cool running water is your best friend for first-degree burns. It helps soothe the skin and reduce swelling. Never use ice or icy water, as it can cause more damage to the skin. Applying a loose bandage or clean cloth can protect the burn as it heals. For more severe burns, or if the burn covers a large area, professional medical help should be sought immediately. We then ventured into the world of managing fractures. The first priority is to keep the injured person still and avoid moving the broken bone. If possible, a splint should be applied to stabilize the injury. Applying ice wrapped in a cloth can help reduce swelling and ease pain. But remember, fractures are serious injuries and always require medical attention. Throughout all of this, the importance of remaining calm cannot be overstated. A clear head allows for quicker, more effective action. Acting swiftly and confidently can make a real difference in the outcome of these situations. So there you have it. Basic first aid for cuts, burns, and fractures. Remember, these are just basics, and more severe injuries require professional medical attention. In conclusion, first aid knowledge can be a lifesaver. It's a tool that equips us with the ability to respond effectively in emergency situations. With it, we can provide immediate yet temporary relief to injuries like cuts, burns, and fractures. But remember, it's not a substitute for professional medical care. It's simply a bridge that aids in minimizing harm until medical help arrives. The techniques we've covered today are only the tip of the iceberg. First aid encompasses a wide array of skills, each vital in different scenarios. And like any other skill, it requires practice. This is why we encourage you to delve deeper, learn more about first aid, and if possible, attend a professional first aid training course. Let's ensure we're not just bystanders in times of crisis. Let's be the difference. Stay safe, and remember, the knowledge you have could be the difference between life and death in an emergency.